With the exception of tuberculosis, malaria kills more people than any other infectious disease. In the 1940s, the spraying of the infamous insecticide DDT almost eradicated malaria, but it has since returned with a vengeance as a result of the emergence of DDT-resistant and other insecticide-resistant and anti-malarial drug-resistant strains. An estimated 3.2 billion people, almost half of the world's population, are still at risk for malaria. Malaria killed almost 500,000 people in 2016, when 216 million people became ill with malaria. Malaria still remains a major killer of children younger than 5 years, taking the life of a child every 2 minutes. 2 species of mosquitoes known to transmit malaria are still prevalent in the United States, meaning there is still a risk that malaria could be reintroduced to the US. We used to have malaria in the United States, but as a result of insecticides and the fact that people spend more time indoors with screens covering their doors and windows, means malaria is almost completely eliminated from the US today. The malarial parasite is Plasmodium, and many species of the Plasmodium parasite are becoming resistant to anti-malarial drugs. Some of the Plasmodium-carrying mosquitoes are also becoming resistant to the insecticides that are used today to kill the mosquitoes. Still, there is no vaccine available to prevent malaria. Malaria is transmitted by the bite of an Anopheles mosquito infected with the Plasmodium protozoan parasite. This protozoan parasite is also non-motile, meaning it's in the sporozoan or Apicomplexa group. There is a sexual and asexual stage of the Plasmodium parasite. The sexual stage occurs in the female Anopheles mosquito, and the asexual stage occurs in the liver and red blood cells of the infected mammal. When a Plasmodium-infected mosquito bites an individual, the infective forms of the protozoan, called the sporozoites, pass from the salivary glands of the mosquito into the person's bloodstream. Within an hour, the sporozoites travel to the person's liver, where asexual multiplication takes place, resulting in forms known as merozoites. These eventually leave the liver and enter erythrocytes, or red blood cells. Further asexual multiplication takes place in the red blood cells. The red blood cells lyse or burst, releasing even more merozoites into the bloodstream. If the mosquito bites while the Plasmodium merozoites are in the blood, the protozoa are ingested by the mosquito and develop into male and female gametocytes, which are sex cells that initiate the sexual cycle inside the mosquito. This results in sporozoites that migrate into the mosquito's salivary glands. Symptoms of malaria usually appear 2 to 4 weeks after the individual has been bitten by a mosquito. However, they may not appear for up to 1 year after infection. The infected person experiences characteristic shaking, chills, and fevers associated with malaria that occur in cyclic patterns. These symptoms are caused by the destruction of a large number of red blood cells, accompanying the release of merozoites and their toxins into the bloodstream. As mentioned, these fever cycles occur through different periods. In the case of Plasmodium malariae, the chills and fever occur about every 72 hours, whereas in the other species of Plasmodium parasites, the symptoms occur about every 48 hours or every 2 days. Several episodes of chills and fever constitute an attack, or paroxysm. Between the attacks, the individual feels normal and fine. Muscle aches, fatigue, diarrhea, and nausea may accompany the chills and fever. Plasmodium falciparum, the most dangerous of the 5 different species, can cause cerebral or brain malaria. Malaria can also cause anemia, a result of the massive death of the red blood cells during infection. If severe, this anemia can contribute to death of pregnant women. Before the early 1900s, malaria was endemic in the United States. But thankfully, we, as mentioned, had those mosquito abatement programs killing most of the mosquito population that carried the Plasmodium parasite. Now, in the US, we only have what's referred to as airport malaria, because infected mosquitoes have been known to survive flights from countries where malaria is present and can transmit the disease to individuals located in the vicinity of the airport. But elsewhere in the United States, it's all but gone. Diagnosis of malaria is often based on detecting the Plasmodium merozoites in the blood cells. Microscopic examination of a blood smeared onto a slide can show these different malarial parasites in the blood. Rapid tests that provide results within 2 to 15 minutes can detect antigens derived from malarial parasites as well. Several drugs are available for treatment and prevention, but remember, antimalarial drug resistance is a serious problem. The better way of combating malaria, especially in rural areas of Africa such as Uganda, is the use of bed nets. These bed nets are still regularly treated with recommended insecticides, but in combination with the physical barrier, reduce the incidence of child death by about 30%. Next, let's take a look at another protozoan disease, babesiosis. Babesiosis is sometimes described as a malaria-like parasite and is caused by the protozoans Babesia. Babesiosis is transmitted by the black-legged deer ticks. When the black-legged deer ticks bite an infected vertebrate host, such as rodents, cattle, and other wild animals, they can become infected. The protozoa multiply and develop inside the ticks and are then transmitted to the next vertebrate host, where they invade red blood cells. As in malaria, the protozoan undergoes cycles of multiplication and reinvasion of red blood cells. Cases may be asymptomatic, but when symptoms appear, they include a severe headache, high fever, and muscle pain, very similar to malarial symptoms. Because the red blood cells are also destroyed, anemia and jaundice can also appear. Avoiding tick bites is the best means of protection against this disease. In the United States, it's been most frequently identified in the Northeast and the Midwest. Next, we'll talk about sexually transmitted protozoan infections. There's really only one sexually transmitted protozoal infection of note, and it's Trichomonas vaginalis, which causes trichomoniasis. Though there's only one sexually transmitted protozoan infection, this disease is actually the third most common sexually transmitted infection in the United States, after HPV, which is the most common, and herpes, which is the second most common. It's rarely also transmitted by contaminated towels and articles of clothing. Many individuals, both female and male, show no symptoms when infected, which is probably the biggest reason why this disease is so common, because there's no indication that an individual is infected. They don't get tested and thus don't get treated. Trichomonas has no cyst stage and therefore cannot survive for long periods outside the host. Instead, it's transmitted directly from person to person, and only rarely by contaminated towels that have just recently been used. In females, if there are symptoms, the symptoms include intense itching, urinary frequency, pain during urination, and vaginal discharge. In males, the disease may be characterized by pain during urination, inflammation of the urethra, and a thin, milky discharge. But again, most infections are asymptomatic. Diagnosis is accomplished by direct microscopic examination of the discharge, looking for presence of actively swimming trichomonads. The infection, thankfully, is successfully treated by an assortment of antimicrobial drugs. Our next topic are helminths. Helminths, remember, are multicellular organisms, animals that contain organ systems. These are worms. Helminths are comprised of eukaryotic cells, which means that their cells have nuclei. And helminths are divided into two different categories: the roundworms, called the nematodes, and flatworms, or platyhelminthes. The parasitic mode of existence of worms eliminates or greatly minimizes the need for a sophisticated digestive system, nervous system, and method of locomotion. So their primary organ system that worms have is their reproductive system. The reproductive system is almost always comprised of sexual organs. Some worms have a male version and a female version, while referred to as dioecious, while other worms exist in hermaphroditic forms, which means that a single worm can produce both sperm and eggs. These helminthic diseases are listed in Table 14.4 in your text as a nice reference guide. But we're going to go over in more detail some of these individual diseases, starting off with foodborne and waterborne helminthic diseases. The first of these is ascariasis. Ascariasis is caused by the Ascaris worm, known as Ascaris lumbricoides. This is a large roundworm that resembles earthworms. However, earthworms are in a totally different classification system as helminths and should not be confused between the two. These large roundworms set up in the small intestine, and the female Ascaris roundworms can grow over to a foot long, whereas males tend to be a little bit smaller. An estimated approximately 1 billion people around the world are infected with the Ascaris worms. Ascaris is now uncommon in the United States, where once it used to be a lot more common. The infective eggs are shed into the soil and feces of infected individuals. People become infected when they ingest food or water contaminated with the eggs. Once in the intestine, the eggs hatch into larvae, which penetrate the intestinal wall and begin their journey through the body. They enter blood vessels and are carried along by the blood flow into the heart, and then into capillaries of the lungs, where they migrate up the respiratory tract and enter the back of the throat, back down into the digestive system, where they're swallowed into the small intestine. There they mature into male and female worms over a period of 2 to 3 months. Female Ascaris roundworms produce 200,000 or more eggs per day and can live for up to 2 years. Many people experience no symptoms when infected with these worms, but in some people, damage to the lungs may occur. Malnutrition is also a concern, especially in areas where nutrition is already an issue. However, when the roundworm burden is really high, these worms can block the intestinal areas, and perforation of the intestinal tract may occur, leading to death. The presence of Ascaris eggs or roundworms in the feces is diagnostic for an Ascaris infection. The adult worm may also be coughed up or passed in fecal material. Thankfully, there are drugs that easily treat Ascaris worm infections. They work by temporarily relaxing the roundworms, causing their passage to leave through the anus as they're paralyzed from the drug. We'll talk more about these different worm infections